Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
What are you putting in your mouth? What's in your toothpaste? Are you using mouthwash? You better tune in today, and I'm going to have my own mind blown. I'm a little afraid of the answers I'm going to get, but welcome to Accelerated Health with Sara Banta, where I cut through the noise and fast track your journey to better health. I'm your host, Sara Banta, CEO and founder of Accelerated Health Products and certified by the National Association of Nutritional Professionals. I'm here to share the latest on supplements, wellness hacks, and natural health solutions that actually work, and maybe some things to actually reverse the damage that we've already done that we can't do anything about, right? From boosting energy to detoxing to balancing your hormones and everything in between. I will help you reach your optimal health. So let's dive in. I'm so excited to have our guest back, Bryan, Dr. Nathan Bryan. He is my go-to for nitric oxide. And you might think, well, what is that? Why do we even care, right? Because it's just this little molecule that we learned about in chemistry class, and then we forgot about it and never thought about it again. But it might be the source of your health issues. And all of you are suffering from some sort of chronic health issue nowadays. So welcome back, Dr. Nathan. How are you?
Sara, great to be with you. I'm doing well, thanks.
Well, every time I talk to you, I think about my dad, and I can safely talk about him because I don't think he'll listen. But because he's a Mr. Western medicine guy, and he does the mouthwash, he does the Pepsid, he does, the fluoride toothpaste. I think they had Crest. I mean, the oldie, I mean, the worst of the worst, right? And he's on the medications for his heart. He's got issues. He's got blood sugar regulation issues and all of these things. And I'm just sitting back, and I've learned my lesson not to try to tell him anything because he doesn't listen, and then that goes nowhere. So anyways,
That's very predictable. What you described is so common, but it's so predictable. Yeah. I mean, it's a very simple fix, but yet it's so difficult to get people who are wired in that way of thinking and just trust doctors, and whatever the doctor says is the gospel, and that's what they do.
Yeah, it is really unbelievable. And even as doctors, sometimes will say things that mimic what I say, like don't stay on that Pepsid for too long. It's not meant to be a long-term drug. But the connection between those issues that we've talked about and this molecule, nitric oxide, is even mind-blowing to someone like me who eats and drinks and breathes all health stuff all day long, right? But where we're going today is really going to make me cringe, and most people, because it's talking about our mouth and our dental work and our toothpaste and how that can actually be affecting our health. I mean, I do know, and I've heard, I don't know much about it, where every tooth represents a part of your body. So if you have a tooth issue in one part of your mouth, it's connected to a certain organ, and maybe you can talk about that. But let's dive in, and I don't even know where to start.
Well, I think we start at the beginning. I mean, health and disease starts in the mouth, right? It's the opening part of our gastrointestinal system. We know that, the microbiome is extremely important. We have a clear understanding today that if you destroy the gut microbiome, it causes systemic disease. If you destroy the skin microbiome, you're prone to fungal infections, dermatitis. I mean, so it's all about the bacteria that live in and on our body, and us doing things to support them rather than trying to kill them. And so, the entire microbiome has been mapped. A lot of people started in the gut. We started in the mouth about 20 years ago, trying to identify what are the necessary bacteria that are responsible for the production of nitric oxide that we found back then could lead to better management of systemic blood pressure. And that was such a far-stretched idea, right? And when I talk to cardiologists and vascular biologists, and they would go, what are you talking about? How are the oral bacteria tied to regulation of systemic blood pressure. And that's where this molecule nitric oxide comes in, because nitric oxide is the primary vasodilator, it's the primary anti-inflammatory molecule. It kills oxidative stress, prevents the immune dysfunction that we see in chronic disease. And so now there's a clear tie between oral microbiome, oral dysbiosis, nitric oxide deficiency, an elevation in blood pressure, and a rapid onset of chronic disease, including insulin resistance and diabetes.
When people talk about the gut microbiome, I think it's more understandable because they connect it to, well, yeah, I'm bloated, I've got dysbiosis, I'm constipated, I have diarrhea, I have all these symptoms. So what are the symptoms if your mouth is, the microbiome in your mouth is off?
Well, number one, you get bad breath, halitosis, because it's a dysbiosis, right? You get the odor-causing bacteria, the sulfur producers, that causes chronic halitosis. The other thing is it changes your the pH and the ecology of the microbiome. So you become acidic. Your salivary pH drops, and that completely changes the communities of bacteria. You get predominant of the caries-causing bacteria that lead to gum disease, tooth decay, gingivitis, periodontal disease. So really the solution is trying to figure out, how do we improve the diversity of the oral microbiome? So what we're finding is anything that's antiseptic, which includes antiseptic mouthwash. So when you see the commercials that this mouthwash kills 99.99% of the bacteria, believe it. And yet these companies are advertising this and are proud of it. But and it's causing chronic disease. And then the other thing is fluoride. 73% of the municipalities in the U.S. put fluoride in their drinking water. Why do they do that? Because it kills bacteria in the drinking water. It kills bacteria when you drink it. It kills the bacteria on your skin when you bathe in it. It lowers IQ by as much as 7 points in young kids. It shuts down your thyroid function. I mean, fluoride is a nasty, nasty electrophilic molecule that causes enormous oxidative stress, and it's a neurotoxin. And so we have to eliminate exposure to fluoride. And I think now we're starting to see a change in the conversation of let's eliminate fluoride, because even the regulatory agencies now, looking at the preponderance of evidence, even the National Toxicology Program, showed that fluoride really provides no benefit. 50, 60 years ago, we thought it helped mineralize teeth and prevent caries and gum disease and all that. But now we realize it really provides no benefit. And moreover, it's causing enormous risk. 7-point drop in IQ in young kids, and many people can't afford a 7-point drop in IQ, unfortunately. So if it provides no benefit and it's causing chronic health problems and it's all risk, then that's a very simple quotient, right? You just eliminate it. You eliminate it from every source of exposure on Earth, at least to humans.
So you're speaking to the choir, because I talk a lot about fluoride, and you mentioned it lowers IQ in children. If it's lowering IQ in children, does it not affect us adults too? Of course it does. It dumbs us down too, right?
It's just the study. The studies were done in young kids because, that's our most vulnerable population. So, yeah, of course, if it lowers IQ in young kids, it's lowering IQ in adults. And again, unfortunately, many people can't afford that loss.
And we also are in an iodine deficient society now too. So
That's
you've
right.
got iodine down and fluoride up, and those fluoride molecules are just replacing or parking their little booties in those iodine receptor sites in our body. And we wonder why chronic disease is skyrocketing in so many ways. So
if you look at the periodic table, and you mentioned chemistry, the periodic table, that's what's called the halogens, right? It's chlorine, fluoride, iodine, bromine. Those are the main ones. And so most Americans are deficient in iodine, 95% of Americans, based on the NHANES study. And then everybody's exposed to fluoride. So it occupies that binding site to iodine on thyroid receptors. You need iodine to make stomach acid. If you can't make stomach acid, you can't absorb zinc. You can't absorb B vitamins, selenium, chromium. You get overgrowth of H. pylori, the ulcer-causing bacteria. And it's just it's a chronic mess, and it's this downward spiral that puts people on a very slippery slope to chronic disease. And Exhibit A is your dad.
Yes. And it's not even just the fluoride, it's the chlorine and the bromide, as you mentioned. So,
Yeah, the bromine, the Subway bread is brominated. Most products are brominated. Mountain Dew has an enormous amount of bromine in it and should never be consumed. And it's a dangerous soft drink.
so we're hoping that the government's going to get it out of the water. But in our homes, we could get rid of the toothpaste. We could say no to the fluoride at the dentist. Tell us how is it affecting the nitric oxide production? And I also want to just recap and summarize all of the benefits of nitric oxide. All of you people out there trying to biohack and do red light therapy, isn't that part of increasing nitric oxide throughout in the body? So that's one of the benefits. Now, you can do it in a lot cheaper way, a lot more of a cost-effective way, and we'll get into that. But let's talk about the benefits of nitric oxide, and then also what the toothpaste and the mouthwash and what they're doing to our bodies.
Yep. So nitric oxide is a gas. It's naturally produced. It's what we call a signaling molecule. So it's how cells in the body communicate with one another. So, for instance, how the endothelial cells, the cells that line all our blood vessels, talk to the underlying smooth muscle and tell them, hey, we need to relax and dilate these blood vessels because I need to increase blood flow and oxygen and nutrient delivery to these downstream tissue beds and cells so they can do their job and activate the mitochondria and mobilize stem cells. So nitric oxide regulates blood flow and blood pressure and circulation, tissue oxygenation. Again, it's the molecule that tells our own stem cells to mobilize and differentiate, prevents our telomeres from shortening by activating an enzyme called telomerase. And then it activates mitochondrial biogenesis and improves the efficiency of ATP production at the cellular level. So everything we know about health, longevity, human optimization is dependent upon adequate and sufficient nitric oxide production. So that's one. So what I started on 25 years ago was try to figure out, okay, how does the human body make nitric oxide? And why do people lose the ability to produce it naturally? If this is such an important molecule, what leads to a loss of nitric oxide production? And then and only then, after you've answered those two questions, can you even start to think about developing product technology? There's so many companies out there trying to sell nitric oxide products. They haven't spent 1 second in a research lab. They have no idea how to count electrons. They don't know anything about enzymology and biochemistry. They know nothing about the microbiome, but yet they're trying to sell products for nitric oxide. And it would be comical if it wasn't dangerous and disingenuous. So here's what happens, and I tell people all the time. So we understand how the human body makes nitric oxide. We understand what goes wrong in people that can't make it, and then we fix it. We can do this through product technology, but more importantly, we can do this through simple lifestyle modification. So as I mentioned, anything that's antimicrobial, antiseptic, whether it's fluoride in your drinking water, whether it's chlorhexidine in your mouthwash, whether it's alcohol or chemical-based antiseptics in your mouthwash, it completely destroys the microbiome. We and others publish that if you use mouthwash, your blood pressure goes up. Your blood pressure goes up because you're killing the bacteria that are responsible for partly producing nitric oxide. So that's number one. Just get rid of fluoride in your toothpaste. Get a home filtration system if your drinking water has fluoride in it, and then stop using mouthwash. Those are 3 cost savings. I mean, it may cost some money to get a home filtration system, but typically those are cost savings. And then the other big contributor is antacids, the proton pump inhibitors, the Prevacid, the Prilosec, the omeprazole, pantoprazoles of the world. Those drugs completely suppress nitric oxide production, both in the lining of the blood vessels and through the oral microbiome, and is causing about a 40% increase in heart attack, stroke, and Alzheimer's. So these are very deadly drugs that no one should be taking. Nobody in their right mind should ever take a proton pump inhibitor.
And it was so crazy is people like my dad are going to their neurologist afraid that the Alzheimer's is coming on. And they're so afraid to have that dementia. But they're doing the exact wrong thing. And then the other part that is so sad too is that our food supply has been hijacked. 70% of the United States or 70% of the food supply is ultra processed food, which my guess is not just really bad for your nitric oxide production, but it's causing the gut acidity issues so that you're having the acid reflux, so that you're reaching for those antacids. And I mean, as a 49-year-old, all of the husbands that I know in my circle, they're all popping them. And they don't know that they're not eating real food because that is what is available. People don't understand that our food supply is not real food. And then you go to Europe or some other countries and it's less exposure, and it's all of a sudden some of these symptoms are gone because you're eating higher quality food. Hopefully we get there eventually with our government and
slow crawl.
Right. But
yeah, no, I spent 10 or 8 days in Italy. I mean, and the food there was, and typically I could eat foods in Italy that otherwise the same foods like pizza or, a lot of breads there or pasta would inflame me. My joints would hurt. I'd get bloated. I'd get gaseous.
Yeah.
And eating the food there, amazing. No effects whatsoever. So it's completely different.
Yeah, so maybe talk a little bit about how that sugar and the processed food is also not just diminishing your nitric oxide, but also your acid balance, your pH balance in the stomach, and how it's just kind of this domino effect.
Yeah, it is. So what's happening is sugar's the poison. Sugar's the enemy. High fructose corn syrup, an elevation in fructose causes an increase in uric acid, shuts down nitric oxide production. That pathway is very elucidated. So any food, any diet that leads to an increase in blood sugar, right? We measure that through glucose, continuous glucose monitors. So glucose, as the name implies, is glue. It's sticky, right? And so if you've ever spilt the soda water on the counter or the floor and then come back the next day, it's sticky, right? You know it's there. It's that sugar. It's glue. It sticks things together. So when it's elevated in the circulation, then it's sticking to proteins. Right, things like hemoglobin, and we can measure that. We call that hemoglobin A1C. It's the amount of sugar that's actually stuck or glued to hemoglobin, a protein, an essential protein that has to undergo a conformational change to offload oxygen and pick up carbon dioxide. But if it's glued together by glucose, you can't deliver oxygen. You can't pick up CO2. Patients develop metabolic disease. They become hypoxic. They develop insulin resistance. They get type 2 diabetes. They can't heal their wounds. They get neuropathy, diabetic macular degeneration. And that explains everything about type 2 insulin-resistant diabetes. But similar to hemoglobin, it binds to the enzyme nitric oxide synthase and glues it into a conformational state where it can't transfer electrons to generate nitric oxide gas. So we have to eliminate anything. And, the beauty of these continuous glucose monitors is anybody can get them. You don't even have to have a prescription for them. But people should wear these and monitor them. And if you're eating a food and you see a rapid increase in blood sugar, then don't do that again, because that is a sign. Your body telling you, stop, you're killing me, literally. And then, with the dysregulation of acid-base balance. So then what happens is you eat that, you get gastric reflux, then you put on antacids. And then in order for the human body to do two things, break down proteins into amino acids, and to regulate acid-base balance, you absolutely have to have stomach acid production. Because trypsin only works in an acid environment that breaks down plant or animal proteins into amino acids, and then we use those constituent amino acids to make human proteins, right? We don't assimilate animal proteins or plant proteins. We break those proteins into amino acids and we make human proteins out of them. That's physiology. Then the other important aspect of stomach acid is when you dump that, when you have gastric emptying and the contents of the stomach are emptied into the duodenum, which is the very proximal gut, the small intestines, it senses that acid dump. And then that tells the exocrine pancreas to secrete sodium bicarb to buffer that, right? And it's that secretion of sodium bicarb that regulates acid-base balance in the blood and to maintain cellular potential of minus 25 millivolts. And if you take minus 25 millivolts, you put that through the Nernst equation, that comes up to a pH of 7.4, which is physiological pH. It's a potential hydrogen or electrical potential that's needed to maintain cell membrane integrity and to maintain intracellular or transmembrane signaling. So inhibiting stomach acid production, if I wanted to make you chronically ill and make you dependent upon drug therapy for the rest of your life, the number one thing I would do was inhibit stomach acid production. Next thing I'd do is I would get your cholesterol taking a statin medication. And I'd fluorinate you. I'd put fluoride in your toothpaste, your drinking water, and create dysbiosis. And that's a recipe for disaster. And unfortunately, that's what most Americans are suffering with. And to me, it's no wonder why Americans are some of the sickest people on the planet.
Yeah. And that's where I recommend a digestive enzyme with HCl in it.
Absolutely.
And I take HCl Guard every day with all of my meals. Before we get into the toothpaste conundrum, I want to just pinpoint the lozenge, the NO lozenge. I take it every single day. I suck on it. I don't know if there's a benefit to keeping it in your mouth longer, if there's a downside to chewing it and swallowing it. Probably doesn't work. So maybe you can talk about how it works and how to get the most out of it.
Yeah, so the N101 lozenge, I created a solid dose form of nitric oxide gas. Right, so nitric oxide, we have to remind ourselves, nitric oxide is a gas. It isn't a pill you can swallow. If your body can't make it, then we have to do it for you. So this ODT, or orally disintegrating tablet, I developed to have a very specific dissolution rate because I want to deliver a certain amount of nitric oxide over a certain period of time. So number one, never give the body something that it hasn't seen and at a dose that's not physiological. So we know how much nitric oxide a healthy person makes in a 24-hour period through both production pathways. So what I want to do was create restorative physiology, give back the missing nitric oxide that people are missing. And this has been challenging because it's very simple with things like vitamin D, right? You go get a blood draw. If your vitamin D is 20, you dose and you titrate till we get it to 80. It's a very simple number. You treat the number and people get better. But nitric oxide is not something you can measure in your blood. There's not a number that we're treating. It's actually delivering the same amount of nitric oxide that your body may be missing. So I designed that to have a 5 to 6 minute resident time. So you put it in your mouth, you move it around. Depending upon how active you are, it's usually 5 to 6 minutes. Some people are more slow, so it dissolves much slower. But the design is to be a time release. And so we can understand the pharmacokinetics, pharmacodynamics of once nitric oxide is produced, where it goes, what it becomes, and how it's transported. So that was the design of the lozenge. So it's best to suck on it, let it dissolve. But if you chew it and swallow it, we've done the pharmacodynamics, pharmacokinetics of it. You still get the benefits. You're just shifting the pharmacokinetic curve just a little bit, but you still get the benefit.
And for all of you listening, it's a supplement I take every day. You can find it at Accelerated Health Products. I take it while I'm working out in the morning. I suck on it in the beginning of my workout. Now, is it also affecting your oral microbiome as we're talking about the mouth?
Absolutely. So the other really consideration when I started contemplating a product to restore nitric oxide was, number one, if your body can't make it, then we have to do it for you. But number two, I want to restore the body's ability to make it. So we understand the biochemistry and the rate-limiting step that leads to nitric oxide synthase uncoupling, and so we can overcome that. So this lozenge, we're finding that within 20 minutes of putting it in your mouth, we've improved the body's ability to make nitric oxide in the lining of the blood vessels by as much as 20%. Within 20 minutes, we've already improved your body's natural ability to produce nitric oxide by 20%. And then because it sits in the mouth in the dorsal part of the tongue, we're completely changing the diversity of the microbiome because most pathogenic bacteria are sensitive to nitric oxide. Nitric oxide will bind to the iron sulfur centers of the bacteria and shut down their respiration and kill them. That's how our immune system works. But unfortunately, if you develop oral dysbiosis, there's no nitric oxide producing bacteria in the mouth. So now these pathogenic bugs overrun and kind of overtake the police force. And now you get a decrease in salivary pH, you get caries causing bacteria, and you completely change the ecology. So when we put this lozenge in our mouth, we're now killing the bad guys. We're giving these bacteria, these nitrate-reducing bacteria, a nitrogen pool that they can now respire on. So we wake them up, we increase their numbers, and improve the diversity of the microbiome.
And is there a benefit to taking more than one a day? Or, can someone have too much nitric oxide in their body?
It typically doesn't happen. And the only scenario that was contemplated, even 30 years ago was during sepsis, right? So when patients get septic, it means they have a systemic infection, their immune system are trying to fight wars on all fronts. And it was thought that the immune cells are making too much nitric oxide, you get systemic vasodilation, you lose perfusion pressure, you get end organ damage, and you die from it. So in the 90s, there was some randomized placebo-controlled clinical studies in septic patients giving them nitric oxide inhibitors. And the results from those clinical trials that if you gave septic patients a drug that inhibited the production of nitric oxide by our immune cells, they actually got worse. And it increased morbidity and mortality in the septic patients. So that told us, I mean, septic, clearly there's hypoperfusion and loss of perfusion pressure, but nitric oxide appeared to be protective in that mechanism. So what do we look for in terms of toxicity? You look for an unsafe drop in blood pressure, and you look for methemoglobinemia. So you can there's benefit from taking more than one lozenge a day, but because of the nature of nitric oxide, I designed it to be taken once in the morning, once in the evening, 12 hours apart. Then that gives you kind of your 24-hour nitric oxide support for somebody who's just interested in maintaining optimal nitric oxide levels. But in the perfect example would be your dad, for example, or people with metabolic disease, ED, high blood pressure, insulin resistance, mild cognitive impairment, or dementia. They may need one lozenge every 4 to 6 hours because their metabolic demands are much different than you and I, who are healthy and trying to maintain a health, rather than somebody that's sick and trying to get to health.
Okay, so last question, I promise, before we get to the toothpaste and the mouth, specifically immune system and the pandemic. You know, a lot of people, due to what the spike protein has done to the ACE2 receptor, we are seeing low thyroid, water retention, oxidative stress, inflammation, livers being backed up. How is increasing your nitric oxide going to help with any of those issues or all of them?
Well, I think it's going to address most of those issues because mechanistically we knew, and today we know, certainly that the people who got sick and died and developed symptoms of the coronavirus were the people who were nitric oxide deficient, right? So there were high-risk, susceptible populations. Those were the elderly, people with high blood pressure, diabetes, previous heart attack, kidney disease. All of those are symptoms of nitric oxide deficiency. So when your body can't make nitric oxide, you get an upregulation of the ACE2 receptor, and that's the attachment site and the target of the spike protein. But if your body makes sufficient nitric oxide, you downregulate the ACE2 receptor, so you may be exposed to the coronavirus, but there's no site of attachment, so it can't make you sick. It can't penetrate the cell and replicate and propagate throughout the body. And that was me. You know, I've never had COVID. I never had COVID. I didn't wear a mask. I didn't get a shot. I was on an airplane every week for 3 years during COVID, and I never got sick. That just shows you that your immune system, number one, if you can block attachment of viruses, then that's protective. But number two, if we're exposed and there is attachment, your body elicits an immune response. Those macrophages and neutrophils go to the site of attachment, generates nitric oxide, and it shuts down viral replication. That's well established in the scientific and medical literature. So nitric oxide is extremely protective from not just COVID. COVID killed the same people that flu kills every year. Right? People that get sick and die from seasonal flu are the same people who get sick and died from COVID. It's the immunocompromised and the people who can't make nitric oxide.
Well, I'm getting on a plane this weekend, and you better believe I will be taking my lozenges with me. So yes. Okay. So now we're getting into the mouth, and we've talked about fluoride in our toothpaste. We know we got to get that out. Okay. And if you haven't gotten that drilled into your brain, re-listen to my past interviews with Dr. Nathan. But what about the toothpaste that are fluoride free? What about the other stuff we're putting in our mouth? And also, what about that dental work we've had done? Root canals, crowns, sealants. I mean, what are we doing to our mouth when we go to the dentist?
Yeah, you know, dentists can be some of your best friends or your worst enemies in terms of predicting your long-term health outcomes. So fluoride. So, you know, I learned the dangers of fluoride probably 20 years ago. And so I was buying a fluoride-free toothpaste. And there's maybe a dozen really what I thought were good branded products. But number one, I was just looking for the elimination of fluoride. And I really wasn't paying attention to the other things in there. And so I struggled trying to find a toothpaste that was, number one, fluoride-free. Number two, that had components in there that helped me remineralize teeth to keep my teeth strong and healthy. And then number three was something to help support the microbiome and not destroy it, because most of these toothpastes have detergents in them that destroy the biofilms, disrupt the ecology. And so after 4 to 5 years of frustrations, I started developing my own toothpaste because, number one, I understand the microbiome. I understand what we need to restore these bugs and these different populations. And so I made my own toothpaste. So it's obviously fluoride free. It's a hydroxyapatite based toothpaste, so it remineralizes the teeth, improves the strength of the teeth. But we also put components in here that restore the oral flora, that maintain optimal salivary pH. So we're creating an environment for optimal diversity of the oral microbiome. We're optimizing nitric oxide production. And remarkably, Sarah, what we're finding is people, 2 out of 3 Americans have an unsafe elevation in blood pressure. And we take people off Crest, Colgate, and in their toothpaste, and we just put them on the Cardio Smile, and we target the microbiome. We eliminate the things that are destroying it, and we're doing things that promote it. They report that their blood pressure comes down. And high blood pressure is the number one driver of the number one killer of men and women worldwide. So I'm not asking you to try something new. I'm just asking you to simply change something you've already done. Buy our Cardio Smile toothpaste instead of the toxic microbiome killing, high blood pressure raising, ED causing toothpaste that you're already using, and watch your life transform.
And you're going to save money because you're going to stop all the medications that you have to go get from the pharmacy.
Yeah, no, look, this isn't a cheap product. I mean, admittedly so. You can go out and buy some cheap fluoride toothpaste for, $6 or $7 a tube. But, because of the cost of what we try to do and put in there and accomplish all the things, that this is pricing. We sell this for, I don't know, 20 or 24 bucks, 25 bucks or something. But I think you make a good point. Up front, it may cost, a little bit more, but long term, it's going to save you money because we're finding we can get off prescription medication. And what price tag are you going to put on your health? Right. The health is our greatest asset. How can you put a price tag on that?
The other scary thing is I've seen reports on some of the natural fluoride-free toothpaste that have other toxins in them that you're not even aware of. And here you are, you're not just being exposed to them, but you're literally brushing your teeth with it and just driving it into your gums and your tissues and causing inflammation. And who else knows what is going on systemically?
Yeah. No, it's a huge issue. And, we're working on a mouthwash now because 2 out of 3 Americans use mouthwash. And, people want a fresh breath. I get that. And so I felt I had an obligation to give them a safe alternative to the antiseptic mouthwash. And so, again, we're targeting the microbiome. We want to support the microbiome. And we want to leave the breath in the mouth, with an optimal pH that provides an ecology and environment for the right bacteria and leaves it fresh, clean and minty. So we're working on that. It's an incredible product. We'll probably have that out in the next couple of months. But that's where it starts. And then the other thing is, when you go to your dentist, we're finally making headway with the dental groups. I spoke before the American Dental Association last summer. We're finally getting their attention on the practice of dental medicine and the elimination of fluoride, the dangers of root canals, the dangers of metal in your mouth, mercury amalgam fillings, and, just being able to look deeper into extracted teeth and cavitations, asymptomatic infections, osteonecrosis that may not show up on x-rays, and to just dig a little bit deeper and, pay attention to your dental practices.
Yeah, and I want to get into that real quick as far as what are the downside. Here you are, you've got a bad tooth and you need a root canal. Should you not get the root canal? Or how do you recover? What is it doing to you? And then how do you recover and reverse the damage that you may have done a few years ago because you had to get a root canal?
Yes. So if you have a appendicitis, right, or you've got a necrotic gallbladder, if you don't take that out and you leave dead tissue in the body, you will become septic and you will die. It's a known phenomenon in physiology and medicine. But yet many dentists think it's okay to leave a dead tooth in the body. Because here's what happens. You have a toothache. It's typically from an infection. So what the dentists do, a typical dentist will go, and an endodontist specifically, they'll go in that tooth and they'll remove the nerve root from that tooth. The root canal is removing the nerve root so you don't feel the pain from the infection. and then they take out the blood supply to that tooth. So a tooth is a living organ in the body, right? It's a crystalline structure, but it's living. It needs blood supply. It needs nerve conductivity. So you take out the nerve root, you take out the blood supply, and then they fill it with a composite material. But there's so many small crevices in there that you can never get to completely fill all that. So there's always a remnant infection. And then they send you home with an oral antibiotic. But I think they must have forgotten that the antibiotic is not going to get the infection because they've taken out the blood supply to that tooth. So now that infection is completely isolated from your immune system. And these are anaerobic bacteria who don't need oxygen to respire, so they're completely anaerobic. They're eating away your gum. They're eating your jaws for breakfast, lunch, and dinner. They're excreting toxins. And then every tooth, if you look at the tooth chart or the meridian chart, every tooth in the body is connected to an organ system. And so the teeth are like circuit breakers, right? And everybody knows if we trip a breaker in the house, the lights go off on that circuit. And if you trip a breaker in one tooth through a root canal, there's no longer conduction through there, then it shuts down the voltage to that organ system. So the best example is shutting down the voltage system to breast in women. 95% of breast cancers can be traced back to root canals or dental infections in 4 teeth. The 4 teeth that are connected to the breast on the left and right side.
And which ones are those?
I don't recall. This is something I learned going through these dental conferences. But if you just search tooth meridian chart or meridian tooth chart, it'll tell you. But I believe it's some of the upper incisors and lower ones. But it affects the breast, the prostate, the large intestines, the small intestines, the heart, the lungs. Every organ is tied to a tooth. And so again, it's like when you have a root canal, you've cut that extension cord, and there's no longer any energy transduction or voltage through that meridian. And this goes back thousands and thousands of years to acupuncture. Acupuncture meridians is how these circuits go and how we supply voltage to every organ, tissue, and cell in the body. And if we can't maintain a minus 25 millivolt transmembrane potential, then we flip that voltage, and now the cell becomes plus 30 millivolts, which is acidic, which is the conditions where cancer grows.
So what do we do? What do we do with a tooth that the dentist says you need a root canal? You just leave it?
No. Well, there's a couple of things you can do. You can actually treat the infection through image guiding injections of, say, ozone gas. Typically what happens is you extract the tooth. And so if it's a front tooth that for cosmetic reasons, you don't want to be snaggle tooth, then you extract the tooth, you clean up the infection with ozone gas, because ozone gas will penetrate into very small tubules and completely kill the infection all the way in the jawbone. And then a lot of times the dentist can make you what's called a flapper or a bridge until you can get a permanent implant. But a lot of people who have a chronic infection, there's so much osteonecrosis and bone loss that it can't even support an implant. And that's why implants fail, because the bone structure is so weak that it doesn't provide enough material to support that implant. So many times, including myself, I had a root canal 20-something years ago. And it was asymptomatic in terms of symptomology, but it had completely eating up my upper jawbone. I had to have a bone graft to regrow bone to then support an implant. So that's the typical kind of procedure in the remediation process for a root canal. And then if you've had root canals, you absolutely have to go and get them tested, and then most likely get extracted, clean up the infection, and you see people's health completely change from cleaning up infected root canals that they think is asymptomatic. But they may have eczema, they may have fibromyalgia, they may have some idiopathic syndrome that's unexplained, and you go in and get your dental infections cleaned up, and suddenly the symptoms go away and people get better.
Well, it's just a reminder that if you've been to the dentist and had some dental work, and then all of a sudden some symptoms kind of show up, and a couple of weeks later, you might want to connect the dots. I'm assuming that boosting your nitric oxide following some of this dental work might be beneficial in reversing some of the damage.
I mean, it'll certainly mitigate and reduce the inflammation. Some of my patents are on a method of reducing inflammation, C-reactive protein with nitric oxide. But again, it's not. I mean, nitric oxide can't diffuse far enough into that gum lining jawbone to kill the infection. So you still have to go through the process of addressing the underlying issue, which is an asymptomatic infection that's isolated from your own immune system. So you've got to fix that. But certainly, nitric oxide will support blood flow, circulation, reduce the oxidative stress, immune dysfunction, and the inflammation that we see in these patients.
Oh, wow. Well, I can tell you that I will be doing my lozenges once to twice a day, and I can't wait to have the toothpaste available for all of you at Accelerated Health Products too. It is going to be on my site. I can't wait because selfishly I need it readily available, and I have tried every fluoride-free toothpaste. I just cringe at thinking at what else is in there that I don't even know what it's doing to me. I mean, we're coming to this realization, Nathan, that like even Sprouts, I heard, is spraying their organic food with non-organic substances to make it look fresh and clean when we go to the store. So it's hard to even know what we can trust now. So I really thank you for providing supplements and products that are just game changers in this world where we just don't even know what to touch or use anymore. So thank you. And are there any last points that you want to make sure that we cover today?
Now, look, we've covered a lot. I think, certainly oral hygiene, dental health, finding the right dentist. For those interested, there's two really good organizations from dentists who understand this whole type of practice. It's an organization called International Association of Biological Dentistry and Medicine, or IABDM.org. There's another organization called the International Association of Oral Medicine and Toxicology, IAOMT.org. And on their website, if you put your zip code in there, it'll find you a biological dentist in your area that can help you mitigate some of the risk associated with either previous root canals or, find a dentist that understands this and be proactive instead of reactive. But no, I'll just, I don't know if I launched a new book a couple of months ago called The Secret of Nitric Oxide, Bring the Science to Life. My strong bias is it's a must read. You can find it at nathansbook.com or Amazon, Barnes & Noble, anywhere books are sold. But, I just encourage people, get educated, get informed. And, I think it's very important. The information's out there. We just have to, take action on it and make some changes. Sometimes small changes make big effects.
Yeah, our small changes in our house personally, but then also putting the pressure on our government and our, Utah and Florida, they're getting fluoride out of the system. Texas is talking about certain ingredients in their foods that's not for human consumption. So we're getting there. And it's just really crazy. Even at the high level athletes, my daughter was on an athletic team at USC, which is, they've got plenty of money to support. They run their sports like professional teams. You walk into their athletic facility and they've got Gatorade and those little peanut butter and cracker snacks for their protein filling snacks. And you're sitting there going, oh my gosh, these are the top athletes and that's what they're feeding them. So we've got a lot of work to do. and
we've come a long way, but we've still got a long way to go.
We do. Well, where can people find you, your book you just mentioned, following you on social media?
Yeah, nathansbook.com for the book. I've got a YouTube channel, Dr. Nathan S. Bryan, Nitric Oxide. Social media, Instagram, Dr. Nathan S. Bryan, LinkedIn, Twitter, Dr. Nitric. I'm searchable on most search engines.
Awesome. And I always love the beautiful food that you post. It makes me very hungry and makes me want to eat my protein. So thank you. Right. And thank you for today. And super excited to try the toothpaste and share it with all of my followers and customers. So thank you, Dr. Nathan.
Thank you so much, Sarah. Good being with you.
All right. How many of you are just second guessing everything that you do? The dentist trips, the mouthwash, what you're doing for that stomach acid and the acid reflux. Oh my goodness. And do you have a water filter on your system at home? You need to check it. The thing about fluoride is that it's a very small molecule. So even if you have water filters on your drinking water or your house filtration system, it might not be good enough to grab the fluoride because fluoride is so small. So Dr. Nathan talked about fluoride and iodine, and I also want to touch on how the iodine is increasing that nitric oxide. It supports endothelial health. It reduces the oxidative stress in the blood vessels, allowing better nitric oxide signaling and vasodilation. So the acceleradine iodine is going to work with the NO lozenges to boost that nitric oxide even more. And the acceleradine iodine displaces all of the halogens that block the production of nitric oxide, the fluoride, the bromine, the chlorine that interfere with that NO synthesis. And iodine helps remove these from the tissues. It boosts thyroid hormone, that active one, T3, that's your metabolism. Active thyroid hormone is needed for nitric oxide synthase, NOS, to function properly. And it improves mitochondrial output. So iodine increases that mitochondrial efficiency, supporting ATP production and nitric oxide signaling in energy-demanding tissues. I love it that all these people are doing NAD, peptides, and all of these stem cell treatments, peptides, all these things to boost your mitochondrial health. Just boost your nitric oxide and your iodine sufficiency throughout your body, and you're going to boost your NAD naturally. And then iodine also reduces inflammation. By lowering systemic oxidative stress and inflammation, iodine preserves that nitric oxide from being downgraded prematurely. Now, also methylene blue. It helps with nitric oxide. It modulates the nitric oxide synthesis. It protects the mitochondria from nitric oxide damage and so many other things. And I love the accelerated methylene blue. It's been shown to help with preventing Alzheimer's, boosting your immune system, being antiviral, all of these things. The nitric oxide, iodine, methylene blue are all antipathogenic, antiviral, boosting the immune system. Methylene blue enhances the microcirculation. And then you've got accelerated C60. So all of these I'm mentioning are really good for boosting your immune system. But the C60 stabilizes the nitric oxide. It neutralizes free radicals like superoxide, preventing nitric oxide from turning into peroxynitrate. Okay, so these are just some other things to enhance your nitric oxide levels on top of taking the NO lozenges that I take every morning. I love sucking on it as I'm working out. I feel like it's boosting my circulation, getting the blood flow to my muscles, and then also to my brain. So I have the more motivation to keep going with my workout. So those are just some tips that I recommend trying out and seeing how you feel. And then, of course, leave a comment below and let me know. Thanks for tuning in to Accelerated Health with Sara Banta. I hope you have the tools from today and some inspiration to take the next step. Don't be overwhelmed. I know it's super easy to be overwhelmed with everything that we've gone over, but just take a couple steps at a time and you will see a difference in your life. You can head to SaraBantaHealth.com for more articles and more details explaining what we talked about. Join the free group coaching on Telegram, and that link is on my website at SaraBantaHealth.com. You can shop the supplements that we talked about, the NO lozenges, the accelerated iodine, the accelerated C60, the accelerated methylene blue. They're all at acceleratedhealthproducts.com. You can use coupon podcast 10 for your first order. So hopefully this helps. And if you love what you heard, share with your friends and family members, people like my dad who are doing all the wrong things for their nitric oxide production. Sorry, Dad. And this podcast will hopefully make them start thinking, but it also will help more people hear this podcast and reach more people like you by you sharing this podcast. So thanks again for listening. Remember, I'm live every Monday, Wednesday, and Friday. So join me next time for more ways to unlock your health potential.